Hey, I'm Beth Heitzman, and thank you so much for joining my very first YouTube video. And the reason why I've decided to create this video and to start this channel, it's because I wanted to talk about things related to aging and learning. Because lately it seems like I've been aging a lot and learning a whole lot. And some of the things that I thought were true have kind of been turned upside down. Now, I don't know about you, but lately, when I've been going to the doctor, I've been hearing things like, well, you could expect these things at your age. It's like, what does she mean my age? That's for old people. I am still a young people. How did I become the people my age? And like for me, what was showing up in my life is I talked to my doctor about I just can't seem to lose weight that no matter what I do. And she says, well, you know, that happens as we get older with people at your age, it becomes harder and harder to lose. And if you've been dieting all your life, and I think I joined my grandmother on Weight Watchers when I was 12 years old, your metabolism is probably really messed up. So, you know, it's going to be just a lot harder for you. And then I started having to go on some medications for blood pressure. The blood pressure went up. Well, that happens with people my age. And then I didn't have to go on medicine, but I was pre-diabetic. So she said, we need to watch that. So she recommended the American Diabetes Association diet. And we tried that, but just absolutely no luck with that. And then I came home, and my husband and I were going to pack for a trip. So he has this like big pill box that he gets that you can divide it by morning and night days. So he pulled out this cardboard container out of his closet, and there had to be, I think, probably about 8 different meds in there that he had to pack for us to go away for the weekend. His high blood pressure medicine, because that's what we have to do at our age. He had also been diagnosed with diabetic, and that just came out of the blue. Ned has never been overweight. He's basically been in good health. Nothing has tested pre or anything, and all of a sudden he's diabetic. And the doctor kind of let us know that sometimes people with less fat to absorb can have the greater risk to go into diabetes at our age. So he had also had some surgeries. He'd had some back surgeries, which affected like his bladder and everything that was going on down there. So they gave him a pill to make him pee, a pill to make things work, a pill, and it was just every time he went in, he was on another pill. So when he pulled out all these pills, and I realized that I'm starting to go on more and more pills because that's what people our age have to do, I just got so frustrated thinking, is this true? Is this really how we have to live just because we're older, or is there something else going on? Well, I found out there's something else going on, but we'll talk about that in later episodes. But I think one of the other things that really drove me strongly is Ned's mom is 93 and she's in a nursing home. And you might say, wow, she's had a long, healthy life. And it's like, yeah, she's had a long life, but it hasn't been healthy. For the last, I'd say, decade or so, she's been in such pain. It's just been painful just to get up, to go to the bathroom, to move. And she's at the point where sometimes she would get so frustrated, she would just say, how much longer do I have to live like that? And she would say, I know I should take care of my health better, you know, I should walk, I should do this, but I just didn't. And yeah, I think there could be a goal to want to live long, but when I looked at her, my heart breaks for her because she's in such pain. And I just wondered, is there anything that I can be doing right now to change that, to where I can have a healthy life, as healthy as I can? Or am I just doomed to keep taking drugs and cholesterol and diabetes and everything that we're told that we have to take? Or is there another way? Well, one of the things that I was dealing with is I had gone on hormone replacement therapy because I thought that's a good thing that women my age should be doing. But then in hormone replacement therapy, I lost my hair. This is actually a wig, so you'll probably see me changing my hair a whole lot because I've learned to embrace wigs. But my hair started falling out from the hormone replacement therapy. So on YouTube, I started watching some videos about how to deal with the emotions of hair loss, because I always loved my hair. I had, 80s big poofy. It was really great. So just dealing with the emotions of losing my hair and wearing wigs, I started watching a girl named Denise Sheets. And she's so helpful and so loving. But what I really noticed is when I would see a video of her now and a video of her, say, just a year or so ago, she does not look like the same person. I mean, she looks like she's gotten younger. Obviously, she's lost a lot of weight, but there was a lot going on. Well, she did come out and made a YouTube video explaining what happened to her. And she explained that she started following a program by Dr. Boz. And what Dr. Boz basically does is a program called Therapeutic Ketogenic. I think that's it. Therapeutic Ketogenic. That might come out wrong, but it's somewhere in that ball game. So I thought, oh no, I cannot do another diet. I have done every other diet. I cannot try another thing. I'm so frustrated. I have done low carb, low fat, Atkins, Weight Watchers, everything. And it's just one more diet. It just makes me want to scream because I just been feeling like I've been sold a bill of goods and nothing is working. So I did have to go over and check Dr. Boz's channel out. And one of the things that she said was with therapeutic ketosis, which isn't like the keto diet necessarily that you find on the internet. There's lots of that going around, but therapeutic ketosis is measurable. So if you're in therapeutic ketosis, she wants you to know what your numbers are. And with her, you find your numbers in two ways. You take your blood, and then you also check to see what your ketones are. And when you do this calculation that you do on the computer, you don't have to do it in your head, you basically can find where your insulin is at. And insulin, we'll talk about that later, really is the driving force for almost every health issue that we're having. So I thought, okay, no wait, this is not just something I'm gonna do, this is measurable. So I was really interested in looking in at that. So we're going to be talking about what we've learned and what we've been doing in this aging and learning process. But right now, let me give you a rundown. My husband has lost, I think, about 20 pounds. He didn't have much to lose. But what's interesting, he's now has a 6-pack ab, and he's not doing sit-ups and push-ups and stuff. He's just getting it from the therapeutic ketogenic diet. I've lost about 25 pounds, and I've got about 25 more to go. But some of the other things that I've noticed was in our mobility, like it's supposed to take the inflammation down, and I really am noticing that. Especially my husband has noticed. He's had 2 spinal fusions, so he's got rods in his back that go all the way up, and he can hardly bend. So no diet is going to take that away. It's there, but the inflammation around it from the scar tissue was just so painful for him. Just bending his shoe, he was just almost in tears because it hurt him. So one morning he comes screaming, he says, Beth, you got to come look at this. And I said, what? He said, look, I'm bending, I can bend my shoe, I can tie my shoe. So we noticed inflammation going down. I also noticed in his face, people have mentioned that we look like we're getting younger, and I see that in his face. It looks brighter and it gets clearer. But I also notice when I watch some of these doctors that I've been listening to, like Dr. Boz, Dr. Westman, Dr. Ken Berry, good old boy from Tennessee, because I'm living in Tennessee. But if you look at their YouTube videos today and revert back to the ones 7 years ago, they didn't look healthy back then. They were just starting the keto, some are carnivore, some are ketovore, they're all in the world. But what I would say, going into the therapeutic levels of ketosis, they look so much better now than they did 10 years ago. So that was just such an inspiration. So my goal for starting this is I realize I can't stop aging. Aging is going to happen, but I can also keep learning. So through aging and learning, if I can give myself every chance, maybe not to be on every medicine, not to be in a plate where I can't get up and down, like, oh my gosh, old age is setting in, I can't do this anymore. Is there something that we can do about it? But we've learned that, yeah, there are things that have been really helping. So I want to share that with you, and hopefully you'll share some stuff with me as we do this process called aging and learning together.